Here we go. Hello and welcome everybody to our most recent webinar on controlling healthcare costs. Glad to have with us today Jason Eisenhut with Employco Services. Jason's been a presenter with EACA webinars before on subjects like safety training and also on employee engagement. Today we're going to take on a very important topic that's, I know, of great interest to all our members, controlling healthcare costs, as it's a continuing challenge to maintain efficiency in healthcare expenditures. Jason and his folks at Employco are experts in this field. We're glad to have them with us. With that, I'll turn things over to Jason Eisenhut. There you go, Jason.
Thanks, Jim. As he mentioned, my name is Jason Eisenhut. I work in the Human Resources Department at Employco. In case you don't know or aren't familiar with us, we are an HR and payroll outsourcing company based out of Westmont, Illinois, which is a suburb just west of Chicago. We handle payroll, HR, benefits, workers' compensation for employers of all sizes, small, medium, large, and typically by coming to us and kind of pooling employers together, bundling them for kind of buying power, we can help employers. But today we thought was a good time of the year to talk about controlling healthcare costs because a lot of employers use January 1st as a renewal date, as their annual renewal date with open enrollment coming kind of in the next couple months. Some employers have off-cycle health plan renewals, but maybe it's a good time of the year to talk about it. In any case, but this is kind of a sensitive issue, an urgent issue, especially with most employers having this as their renewal period. So we'll go through the webinar, and at the end we'll open it up for some questions, and with that we'll get started. Okay, so for the topics for today's session include, we'll talk a range from healthcare cost trends, reasons behind some of the medical plan premium increases. Unfortunately, we see those go up every year, and we'll talk about why those typically do go up every year. Some of the strategies to help employers control some of those costs and the premiums. We'll wrap it up with some open enrollment tips, a nice helpful video from our library, and then we'll kind of open it up for some questions. Okay, this chart shows you what the average premium cost increase is for group healthcare plans. So these are the company medical plans with a group plan with, for example, with Blue Cross Blue Shield or United Healthcare, Aetna. 10 years ago, for example, the costs went up for employer group plans from 2006 to 2007, 11.9%. And if we were to take this chart further back in the early 2000s or late 90s, you'd see these double-digit increases pretty consistently. The good news is, as you can see from the chart over the past 10 years, we've been declining a little bit in the level of increase. So we're still seeing increases. So for example, this year we saw a 6.0% premium increase. That is again expected for 2019. So we've fairly leveled off, which is nice, but it's, I guess, unfortunate that we're still outpacing inflation. But those expected healthcare increases are around 6%. So these are the group healthcare plans, medical plans offered by the companies to their employees. And these percentages shown on the screen are actually before any plan design changes. So what oftentimes employers do is they get a renewal from a Blue Cross Blue Shield or an Aetna or Cigna or United Healthcare showing your premiums for your PPO plan are going up 6%. Oftentimes what employers do, and we'll get to one of these potential strategies in a second, is they lower the plan design, they make it weaker, which lowers the cost. So these, which will eventually be a net percentage increase, maybe you're closer to 4.5%, but raw out of the gate premium increases will be around 6% without any employer changes to the plan design. This chart shows what individuals on the Individual Affordable Care Act market, or what's called the exchange, pay for their health care and what is expected to go up in 2019. So, for example, if you're an individual in Denver, Colorado, not getting your health insurance through your company, but on the kind of the individual exchange market, so I'm going to healthcare.gov or to Colorado's state website. Today, I'm paying around $338 on average for the lowest cost bronze plan. Next year, the insurance carriers in these states and these cities have already been approved by their departments of insurance. That rate, Lucky for Denver residents, is actually going down, which is kind of the unlikely, the rarer circumstance, to 317. So if you're in Denver or in Minneapolis, you're actually seeing a pretty good decrease in your rates if you're on the individual market. However, if you're in a city or metropolitan area near Baltimore at 41% increase, or Seattle at 32% increases, those are extremely sizable. Those are unmanageable. It's hard for individuals to cope with that year to year. These premiums that are shown on the screen are before any tax credits. So there's a premium tax credit offered by the government if individuals qualify for them. So if I'm a resident of Denver and I apply for coverage today in 2018, I'm paying out the retail price is $338. But if I qualify for the premium subsidy discount, it would actually be lower than that. So a couple questions that are asked on the application process are, does your employer offer you as the employee any affordable and comprehensive medical coverage? So if the person's self-employed or their company doesn't offer health insurance, they can say, yes, my employer doesn't offer me the quality health insurance. The second question is, what's your income level? So employees who don't make a lot of money but aren't at the poverty level like Medicaid, they could qualify for this premium tax credit. So 2018, if I'm in Denver, instead of 338, maybe those residents who qualify are paying $200 or $250 for their individual coverage. Some of the reasons behind medical plan premium increases and general healthcare cost increase, some of it's just normal inflation. A gallon of milk or the cost of a new car typically go up every year. Increased prescription drug costs. Although more and more effort is put onto approving generics and getting the brand names off of a patent, there are still a tremendous number of brand name drugs and high cost prescriptions out there as more and more companies try and create these new better acting and better outcome drugs for people to help with their conditions. Demographics and health. So as baby boomers continue to age and they continue to make a sizable portion of the workforce, that typically, as people live longer and work longer, that obviously will bring down the overall health of an organization or the general health of the United States. And in the U.S., we just also have an overall poor health right now compared to prior generations. People are typically not doing as well with diet and exercise as they have been in the past. Government regulation, and the big part there is Affordable Care Act, the ACA, or what some people call Obamacare. So with so much uncertainty around the Affordable Care Act, it's hard for insurance carriers to pre-plan how much to charge their enrollees and members because they're trying to pre-plan ahead to see how the Affordable Care Act is going to affect them. So in fact, one of the Affordable Care Act potential regulatory changes I just saw recently was the Senate is considering a bill that would change the minimum number of hours an employee needs to work for that employer to be forced to offer them coverage. So today, if you work for a large employer, which is typically 50 employees or more, your employer has to offer full-time coverage to full-time employees, which is defined at 30 hours a week or more. This new bill before the Senate increases that to the more standard 40 hours per week, which would be a welcome change from the employer community. The Affordable Care Act bill before the Senate also includes a waiver, a temporary waiver on any Affordable Care Act penalties on employers who didn't offer coverage from, I think, 2015 through 2018. So if you're a company who wasn't offering coverage to your employees and you're large enough, over 50 employees, you received a penalty bill in the mail from the IRS, there is a chance that that might be waived for you if this passes through the Senate and House. There's also obviously increased consumer demand, and a big part of that is new medical technology. So as companies come out with new MRI machines or X-ray machines or new laboratory equipment, that typically costs more money, but typically includes a better outcome for better healthcare outcomes. Okay, the first slide, we have another slide showing next, but the first set of cost control strategies includes premium shift to employees. So today, this is where you're going to shift more of the payroll deduction cost to your employees. Employers typically, in a common year, will shift more of the percentage of the cost to the employees. Today, according to a Kaiser survey, employee-only coverage costs around 18%. Employees are paying around 18% of the premium coverage if they have single coverage. For employees covering families, they're typically paying around 31% of that coverage. So maybe that 18% next year changes to 19% for a typical employer. Employers also typically shift some of the claim share cost to their employees. So if today they're offering a $1,000 PPO as their only medical plan, maybe that changes to $1,250 or $1,500 deductible next year. And obviously that lowers their premiums for the company and for the employee. A trend that has been pretty consistent over the past few years is a consumer-directed health plan, a CDHP, or so another term is high deductible health plan, or HDHP. These are those really high deductible plans that don't cover any first dollar coverage outside of prescription or outside of preventive care physicals, preventive care services, including routine physicals, well woman exams, immunizations. These high deductible health plans are a strategy for employers to promote consumerism. The jury's still out on how much really there's a return on that investment, but they're still pretty popular with medical plans and employers. The most common medical plan is still the PPO style plan. Around 50% of employers offer a PPO as their main plan. Around 22% of employers offer the CDHP style plan. Another common cost control strategy are wellness programs. So these typically include like smoking cessation program, weight loss program, gym fitness center discount. And a lot of times, small employer or fully insured medical plans automatically include these wellness programs. So my suggestion is talk to your broker, talk to your insurance carrier to find out if you have these wellness programs already built into your medical plan. Because if you do, I suggest promoting them to your employees. Maybe it's a home mailing so spouses and others in the household are aware of it. Maybe it's an email, maybe it's a combination. But I just don't think most members of it, enrollees in a medical plan, are aware of these wellness programs that are typically free, and sometimes they even include incentives like you can build up towards a Fitbit or something along those lines. Okay, the next page on cost control strategies also includes a spousal surcharge. This is where employers will charge employees more when they're covering a spouse who has coverage available to them through their own employer. So if my wife is employed and her employer does offer her coverage, if my company, Employco, wanted to do this spousal surcharge, they'd say, Jason, is your wife employed, and does her employer offer her own health care coverage? If I say yes to that, and Employco has a spousal surcharge, they might say, well, Jason, you're going to have to pay an extra $50 or $100 per month to include my wife on the medical plan. So it's on the honor system. The employee might have to fill out an affidavit, but it's a way for employers to say, well, we're willing to pay a lot for the employee and their children, but any spouses who have an employer who offers coverage, we want to charge them more to be on our plan. A nice way to do it, I think this is fairly well accepted and not a lot of employee complaints outside of digging stuff out of your safe in your back part of your closet, is dependent eligibility audit. So this is where companies will ask their employees to provide proof or evidence of the relationship to the person covered on the medical plan. So I have a wife and 2 children on my medical plan. I would need to bring in my copy of my marriage certificate, photocopy of my kids' birth certificates to prove the relationship between me and my spouse or my children and myself. If you don't, maybe you're covering an ex-spouse and you got divorced 3 years ago and your employer doesn't know about it, or your children are really just children of your new spouse and you never adopted them, or maybe you're covering a neighbor's spouse or a neighbor's child just to be nice to the person because they don't have coverage. These dependent eligibility audits typically remove around 5% of the dependents on the medical plan, which saves everyone a little bit of money. Telehealth or virtual office visits, these are also gaining in popularity. So each medical plan typically offers employees or members the ability, instead of going in person to a doctor, maybe it's a 24-hour nurse line, maybe it's a Snapchat or FaceTime video with a doctor who's part of their network. So it saves you kind of the trip to the doctor's office, especially maybe during work hours. You can take a quick break and dial in to talk to a doctor about a sinus infection or a cold and get a prescription over the phone or sent electronically to your pharmacy. A big one is this member education. So with member education, we want to promote some of these wellness programs or the telehealth or virtual office. What we recommend is doing a variety of methods. A home mailing, so we make sure that spouses or domestic partners or adult children in the household are aware of all these plans and benefits, in addition to emails and phone calls. Kind of vary the different methods you use to communicate with your employees to produce the best outcome. Okay, so we're going to take a few minutes. It's about, I think, a 4-minute video to watch a video on open enrollment, since it's pretty much the time of the season and it has to do with open enrollment and good communication. The video we're going to show does a good job at showing you some tips and tricks to how to handle a good open enrollment this next season.
Open enrollment, which typically takes place a couple of months prior to the new plan year. Is the period when your employee employees review your benefit offerings and decide which to select. Some plans stay the same from year to year with adjustments for any changes in the law, while others may feature significant new benefits or changes. Much of what is offered is up to you, the employer, in conjunction with your benefits broker. Along with traditional medical coverage, you may also offer additional health benefits such as health savings account contributions, health reimbursement arrangements, flexible spending accounts, and even gym memberships or other wellness programs. As a general rule, employees and their families must enroll in your health plan during the open enrollment period set by the plan. Except for certain circumstances provided by law, they will not be able to change their mind or sign up for coverage in the middle of the plan year. That's why it's so important for employees and eligible family members to understand all of their options for the coming year now. Employees should consider how frequently they expect to use doctor's services, drug prescriptions, and other healthcare items or services. They may also want to confirm that their doctors are in the network provided by the plan. Your first step in ensuring that this important process runs without incident is to clearly communicate open enrollment dates and timelines. Send your employees a save the date email and post an announcement and a calendar for open enrollment in public places where they'll be seen, as well as on the company intranet if you have one. Second, allow adequate time for employees to review all relevant materials, which will be provided in conjunction with your broker, and to make their choices. Aim to have the materials in employees' hands at least a week prior to the enrollment period, or longer if you have employees traveling or working remotely. The enrollment period itself should last around 2 weeks, with adjustments for the number of employees and their locations. Third, highlight essential information. Group health plan participants and beneficiaries are entitled by law to receive certain information about the plan, including costs, in the form of a summary of benefits and coverage. If the insurance carrier does not assume responsibility for providing the summary of benefits and coverage, the employer must provide it at the same time that open enrollment materials are distributed. Be sure to confirm any contractual arrangement with the carrier to provide this document, and consult with a knowledgeable employment law attorney if you have any questions regarding compliance. You may also consider highlighting important changes in either a separate document or page in the benefits booklet, which will be delivered to employees. Fourth, make enrollment user-friendly. If, like many organizations, you're using an online enrollment portal, make sure that employees understand what to do. Provide training if necessary, and consider dedicating a computer in the office to open enrollment so employees can ask questions as they go. Make sure that your portal includes access to any calculators or tools employees need to make decisions or determine withholding amounts. You may also want to pre-populate the portal with your employees' current benefits selections, which allows them to simply confirm or make changes. Be sure to send an email confirmation of choices after the employee completes enrollment. If something's wrong, allow the employee to go back into his or her account and correct it before enrollment ends. Finally, don't overlook the human touch. Make sure that there's a human resources or benefits rep accessible to employees throughout the enrollment period who can answer questions and serve as a resource. Allocating staff time to this is a wise investment that will limit frustration and ensure a better experience for employees as they enroll. While no open enrollment is likely to be entirely without challenge, careful attention and planning ahead of time can go a long way toward limiting any problems or glitches. Remember, too, your broker or carrier rep is your best resource, so actively engage these professionals throughout.
All right. Bring back up the slides. Hopefully that video was helpful. So we are just about done with the webinar. We'll want some key points to remember. Healthcare costs has slowed down a bit. So it went from those double-digit increases more than a decade ago to over the past decade. It's been kind of trending down to where we are today, around 6%. But that's still outpacing general inflation. Are there any other
states that are in that same boat as Maryland?
Those costs are influenced and affected by a lot of factors, ranging from prescription drugs and generics on the market to the Affordable Care Act and government regulations to know the overall health of the U.S. population. But as employers, we all have several options to try and keep those costs down. from shifting some of the payroll deduction costs to the employees, to changing some of the healthcare plan design, which aren't as favorable, to maybe some of the spousal surcharges, or promoting wellness programs, or promoting some of the employee education.
They have employees at
Annual open enrollment time is a great time of the year to review your strategy before plans are designed. Then once you have a plan designed, re-educate your employees and their dependents about all the plan offerings, including some of the perks, including a potential wellness program. So with that, I'm going to show some of my contact information. So feel free to send me any questions that you have. There's my phone number and email address. Feel free to reach out to me whenever you'd like. With that, I hope that you enjoyed the webinar, found it useful, and we'll open it up for any questions.
Could you elaborate on TPA? What does TPA plan stand for?
I think we've about plateaued. We might stay, our analysis is showing that we're going to stay in the range of 5.5 to the low 6s. So where we are planning for 2019 at 6.0%, we think that's going to continue for the next few years, 2020, 21. Who knows what the election cycle might bring, but outside of government regulation, we unfortunately don't see any significant help in the near short term to get that down to 3%, 4%. So we anticipate it's going to hover around 6% for the short term.
Review of healthcare in our country these days and what folks can do. We have a lot of members that are in the same situation as Darlene and Renaissance that have multi-state employees. So I imagine that information in particular is going to be very helpful. Thank you very much, Jason, for taking the time out of your schedule to share that information.
Yes, it definitely does. So the ACA exchange is actually made up of insurance carriers. So United Healthcare, Blue Cross Blue Shield, Aetna, Cigna might be, and different states have different insurance carriers. And let's say United Healthcare is participating in California, but not Illinois. So different carriers are in different states' exchanges. But yes, so the Affordable Care Act regulation